Current best practice dictates that discharge planning should begin in admission. It is critical to use the whole length of admission to plan for how to best connect the patient with positive community follow-up services, residential treatment facilities, and case managers who may follow up with the individual and provide financial and housing counseling as needed. In conclusion, providing comprehensive care to any patient is important, but it is especially vital for homeless patients. Research needs to continue to fill in gaps in the literature to allow for a holistic approach to care for this population. Further studies on interim interventions are warranted as housing programs have not yet been developed. The interventions proven to be effective now may then be translated to future situations where homelessness has been eradicated.